If you've ever blasted synth beats from your boombox or burned CDs for your besties, this one's for you. As people get older, much like their music tastes, their health needs change. AG1 is the simple daily health drink designed to deliver over 75 essential daily nutrients and pre- and probiotics to support energy, digestion, and mood, so you can make the most out of every decade and dance break. Learn more at drinkag1.com.
At REI Co-op, we've got the gear that makes camp easy. A tent that sets up in seconds. A chair you could fall asleep in. A cooler that keeps things chill. So you can get to the good stuff. Late night laughs, endless stars, and stories you'll tell again and again. REI Co-op. Camp solved. Shop in-store or at rei.com.
Hey everyone, I'm here with my friend Dr. Raj. We're here with the 5-minute care tip of the day. And today we're going to be talking about a topic that we see a lot of commercials about during the Super Bowl and elsewhere, and it's lung cancer and diagnosing it and treatment. So Dr. Raj, what can you share with us?
Well, let's start off by saying in the United States, there is lung cancer screening. And so that means you have no symptoms. Screening is always for asymptomatic individuals. So do we screen everyone? The answer is no. There are very specific guidelines, and it depends on how many packs a day you've been smoking for how many years, what's going to be your age, but your doctor will know these pieces of information. So let's keep it simple. If you're a smoker, you're getting older in age, ask if you qualify for lung cancer screening. Someone's going to ask me, well, how do you do it? So it's not a simple chest x-ray. We order a CT scan of the chest. And to sound like kind of like a doctorish person, a low-dose CT scan of the chest. We don't expose you to lots and lots and lots of radiation. So that's for screening asymptomatic. I also wanted to say today on this is that there are people out there that never picked up a cigarette their entire life and they just got bad luck. They end up with a lung cancer. So lung cancer can also happen in non-smokers, Now, to give a medical pearl, usually it's going to be a type called adenocarcinoma. I know that's a little too much information, but I just wanted to say that. But, what are some things that I think are very important? You know that anytime you go to the emergency department or the hospital, it doesn't matter what you complain about, you'll always end up getting a CT of something. You know what I mean? And when I have my medical students, I always say, sometimes their patient comes in with urinary tract symptoms, but they got a CT of the chest. And you'll end up seeing a nodule. And the minute you see a nodule, what do you think about? Oh my God, yep, cancer. But, there are definitely newer techniques and guidelines out there to how to navigate for these nodules. And it is truly amazing that in certain cases, we can just monitor the nodule. In some cases, we may get what's called a PET scan to see if the nodule lights up and it's something to worry about. Or we have minimally invasive ways to biopsy this nodule with a lot of accuracy. So it's very impressive. So number one, if you do find a, oops, why is there a nodule there by accident? Don't panic. You know what I mean? Talk to your doctor about it and make sure that you realize what is going to be, how we're going to evaluate this. And even if you do have cancer, it's amazing how many new therapies are out there, whether we're talking about modulating your immune system or surgery or radiation. Always be positive.
Yeah, absolutely. And that topic again touches both of my parents who've had numerous CT scans where they found nodules. It was not cancer, but it was good that they had them checked. They saw, because they can look at it, and then that's a baseline, so that you're looking then again 6-12 months down the line, oh, didn't grow, we're fine.
Yep.
So Dr. Raj, thanks as always, and we'll look forward to seeing you next time.
All right, bye everyone.